exciting session on decarbonizing the healthcare sector, building from the National Academy of Medicine's Action Collaborative on the topic. I'm going to turn it over to Mona, who will be moderating this panel for us.
Hi, everybody. That was a terrific session just now, focusing on air quality and pollution and what we can do at every level. And so I am now going to transition to our panel on the pathway to decarbonization of the health sector. We're extremely fortunate to have three expert presences now to inform us on what is going on and the background and just how much is happening. There's a tremendous amount going on. So I'm going to read the three bios very briefly and then turn this over to Jessica Wolff, who is really going to navigate through the session. So Jessica is the U.S. Director of Climate and Health for Healthcare Without Harm and Practice Green Health. She leads the climate team in developing strategies to engage and support the healthcare sector to leverage its political, economic, and ethical influence to address climate change and promote health and equity. And I'm going to give the other two bios as well, so we can afterward just move through the program. Victor Dzau is the president of the National Academy of Medicine, and he is the vice chair of the U.S. National Research Council. He's the Chancellor Emeritus and James B. Duke Professor of Medicine at Duke University and the past president and CEO of the Duke University Health System. Finally, Elizabeth Schenk is the Executive Director and of the Environmental Stewardship for Providence Hospital and Health System, which has over 50 hospitals and 1,000 clinics, where she leads the organization's commitment to become carbon negative by 2030. She is assistant research professor at Washington State University College of Nursing, which has a very forward-looking and innovative, groundbreaking program in hospital management and in decarbonization of health systems. So welcome to Jessica and to the panel.
Thanks, Mona. So let's get started. Next slide, please. We're going to talk about today the healthcare's path to decarbonization. We have a few objectives for this session because you can get continuing education credits. Next slide, please. So our objectives are to understand the global and US healthcare sector's footprint and the roadmap to decarbonize, to learn about opportunities for clinician action and engagement, and to understand how a leading health system, Providence, is working towards a net zero emissions goal. Next slide, please. As Mona said, I'm the US Director for Climate and Health at Healthcare Without Harm and Practice Green Health. And Healthcare Without Harm is an international nonprofit that was founded in 1996. And we work to transform the healthcare system worldwide to reduce its environmental footprint, become a community anchor for sustainability, and a leader in the global movement for environmental health and justice. We work with health systems in the US and around the world to reduce their carbon footprint and prepare their facilities and communities for climate impacts. We also have a sustainable healthcare membership organization in the US called Practice Green Health with a network of 1,400 hospitals. Next slide, please. I wanted to spend a few minutes level setting because the terms decarbonization and net zero goals are really relatively new. We've been using those in the climate space just over the last couple of years. Next slide, please. So decarbonization literally means removing or reducing carbon. However, we're now really using the term to include removing all greenhouse gas emissions. Carbon dioxide is the primary greenhouse gas emission emitted through human activities. In 2019, for instance, carbon dioxide accounted for about 80% of all US greenhouse gas emissions from human activities. We use the term carbon dioxide equivalents, or CO2e, as the unit for measuring carbon footprints. The other greenhouse gases have different global warming potentials, but they're expressed based on the amount of carbon dioxide that would create the same amount of warming. Next slide, please. The GHG protocol, which is the internationally accepted standardized framework to measure and manage greenhouse gas emissions, defines 3 different scopes of emissions. Scope 1 emissions are direct greenhouse gas emissions that occur from sources that are controlled or owned by an organization. So that would include on-site stationary combustion of fossil fuels for heating and cooling, mobile combustion from vehicle fleets, waste anesthetic gases, which is a unique Scope 1 emission for healthcare, and refrigerant leakage. Scope 2 emissions are indirect greenhouse gas emissions that are associated with the purchase of energy. And Scope 3 emissions are indirect greenhouse gas emissions from sources that are not owned or directly controlled by an organization, but are related to the organization's activities. So things like purchased goods and services, capital goods, delivery services, outsourced activities, business travel, and employee commuting. The Greenhouse Gas Protocol has established 15 different categories for organizations when they are inventorying their Scope 3 emissions. Next slide, please. A net zero goal is a trajectory science-based goal that requires organizations to set a goal for net zero emissions no later than 2050, with an interim target of 50% reduction by 2030. The goal must include all emissions, so Scope 1, 2, and 3. And net zero goals are focused on decarbonization. So plans to decarbonize must be separated from any plans for using carbon offsets. Residual emissions, which are emissions that the health system cannot currently reduce based on technological or financial challenges, have to be identified and tracked separately. The next slide, you're going to see a table which compares carbon neutral and net zero emissions. You can go to the next slide, please. So both carbon neutral and net zero goals are terms used to describe when the amount of greenhouse gases that are added to the atmosphere by an organization are balanced or offset by an equal amount of greenhouse gas emissions removed from the atmosphere. But these terms are very different. So net zero goals, as I said, apply to all scopes of emissions. Carbon neutral goals may apply only to carbon dioxide, not the other gases, or may not cover the full organizational footprint. A net zero goal means that you're going to maximize emissions from reduction before applying offset solutions, where a carbon neutral goal is flexible on how you use offsets. And net zero goals must be no later than 2050, which is in alignment with limiting warming to 1.5 degrees, whereas the timeframe for carbon neutral goals are chosen by the organization. So if you see that an organization has a carbon neutral goal, you need to look under the hood and ask some questions. Next slide, please. Now let's talk about the imperative, and you've been hearing about this, so I'll just have a couple of quick slides. Next slide, please. On February 28th, the second of 4 of the working group reports for the IPCC 6th assessment came out. And you can see that the conclusion was the cumulative scientific evidence is unequivocal that climate change is a threat to human well-being and planetary health, and we have a brief and rapidly closing window to ensure a livable future. Next slide, please. Climate change is already impacting the health of everyone in the country, with this, which this group knows. 2020 and 2021 made it abundantly clear that these health impacts are here now and that we are not prepared. This map, which is from NOAA, shows the climate and weather disasters with losses exceeding $1 billion each. 2021 was the second worst year on record for costly disasters nationwide. There were 20 weather and climate disaster events, resulting in the deaths of 688 people and $145 billion in damages. Next slide. And healthcare is on the front line of climate change, anchoring the response to these extreme weather events and the changes we're seeing in disease prevalence. As you all know well, extreme weather events impact both operational and healthcare delivery, and like COVID, can have serious consequences for the financial sustainability of healthcare institutions. Next slide, please. Ironically, even though healthcare is so adversely impacted by climate change, our energy and resource intensive operations make the sector a significant contributor. In 2019, Healthcare Without Harm estimated that the healthcare sector makes up more than 4.4% of net global climate emissions. And other estimates are even higher, closer to 5%. The US is responsible for 27% of global health sector emissions, much more than our fair share. And in the US, the health sector makes up 8.5% of national emissions. Next slide, please. So the imperative is clear, we have to decarbonize, but what does that look like for healthcare? Next slide. So in follow-up to our global footprint report, in April of 2021, we released our global roadmap for healthcare decarbonization, which is the first attempt to chart a course to zero emissions for the health sector. The roadmap identifies how healthcare decarbonization, resilience, and pandemic preparedness can be mutually reinforcing and synergistic. It projects trends into the future and identifies key pathways forward. It is intended to be a navigational tool for achieving decarbonization with climate resilience and health equity at the center. The roadmap highlights 3 pathways and 7 high-impact actions. The first pathway is what the health sector needs to do within its own operations, clinical services, and facilities. The second is what needs to happen in the supply chain, making sure that healthcare products are zero carbon. And the third is making sure other sectors in the economy decarbonize, agriculture, energy, transport, because these will all influence the health sector footprint. And what healthcare can do in this third pathway is to advocate to support these transformations. And that's the work many of you do through the Medical Society Consortium and will be doing when you join the Advocacy Day tomorrow. Next slide, please. The paper lays out 4 different trajectories for decarbonization, taking into account different countries' common but differentiated responsibility for emissions and respective capabilities, the levels of economic development, and the development pathways in the health sector. So as a country with high healthcare emissions, the US must decarbonize quickly, following the yellow line on the graph. While we expect other countries might need to either be stable for a bit or even increase emissions from healthcare in the near term as more people are provided health services. In the end, however, we all need to get to zero emissions by 2050. And this next slide identifies the 7 high impact actions to reduce the health sector footprint. And those include powering healthcare with clean renewable energy, to zero emissions buildings, to implementing a circular economy for healthcare. So each one of these actions contribute to the 3 pathways I just described. Actions within healthcare's own operations, what we need in the supply chain, and wider society. And many health systems around the world are already working in all of these areas. In a few minutes, you're going to hear from Beth Schenk, who's working at a health system with really the leading goal for US health sector. And if I had more time, I would love to share some examples from around the world, but we have to be in a different time. So next slide, please. So what is the opportunity? You know, we know there's an imperative, there's urgency, but it's a time ripe with opportunity. So next slide. One thing you can do as health professionals, oops, I'm sorry. Can you go back one? Is to encourage your health systems to join systems from around the world in the healthcare climate challenge and commit to taking meaningful action in reducing their footprint, building resilience, and using their voice and economic power to change policies and markets. Next slide. And this time is really ripe for doing this work. And what you can do as a health professional is really frame that current opportunity for your health system leaders. There really could not be a better time. We are seeing unprecedented momentum both nationally and internationally. The Biden administration came into office with 4 priorities: COVID, climate, race, and the economy, all determinants of health. They're taking a whole of government approach that is centered in health and equity. And in January of last year, in 2021, the administration directed the Department of Health and Human Services to establish a new Office of Climate Change and Health Equity, an interagency working group to decrease climate risk to vulnerable populations, and a healthcare system readiness council. Next slide, please. At last year's Conference of Parties, or COP26, health was a science priority for the first time. And you heard from Admiral Levine earlier at this conference. And at COP last year, she announced that the US would join over 50 other countries committing to decarbonize their health systems and prepare their facilities and communities for climate impacts. And they're starting with federal facilities. So there was an executive order last December for federal facilities to decarbonize in alignment with the national goal for halving emissions by 2030. This order applies to the Veterans Health Administration and the Defense Health Agency. The VA alone has over 200 hospitals and thousands of health centers, so their actions can help really move the health sector. So the federal government will be supporting this transformation, and they'll be supporting the private sector in this too, setting policies, programs, and incentives to support decarbonization and climate resilience. Next slide, please. And we're seeing momentum in the private sector as well. Last September, the National Academy of Medicine launched an action collaborative on decarbonizing the US health sector, which includes leaders from across the health sector. We have a pre-recorded message from Dr. Dzau, the president of NAM, to tell you more about it. So could we have the video, please?
Hello, I'm Dr. Dzau, the president of the National Academy of Medicine. And it's my great pleasure to open this plenary on healthcare's path to decarbonization. Well, to this learned audience, you all know about the impact of climate change on human health. Next slide. This slide is a high-level summary of the various impacts. Suffice to say that climate change is a public health crisis. 20 million deaths globally a year related to climate, air pollution, vector-borne disease, water and food supply changes, and of course, the forced migration, the climate refugees. We also know that climate change does not affect all communities equally. In fact, there's an inequity in climate change impact. That is, the most disadvantaged countries and populations bear the worst impacts of climate change. In the US, there's inequities in communities of color and other vulnerable populations are very, very evident. Next slide. So as a health community, we have an obligation to act. First, we must treat climate change as a crisis for health and equity. Second, as society's most trusted professionals, we can and should raise the alarm and communicate about these threats. Third, we also have a duty to advocate for health and equity to be the center of planning and policy. And fourth, importantly, we have to hold ourselves accountable for the carbon emission in our sector and be part of the solution. Because as you can see in the slide, US health sector is responsible for about 8.5% of US carbon emissions and approximately 5% of global carbon emission. Next slide. So this is for this reason that National Academy of Medicine launched this grand challenge to improve and protect human health and well-being and equity by working to transform the systems that both contribute to and are impacted by climate change. We have 4 strategic initiatives. First, communication. Second, develop roadmap for systems transformation. Third, to catalyze the entire health sector to reduce its carbon footprint and increase its resilience. And fourth, to accelerate research and innovation at the intersection of climate, health, and equity. Next slide. Well, you know this data well. If you look at our US healthcare sector, the source emissions are the following. Scope 1, from emissions from direct healthcare and healthcare facilities, about 7% of total health sector emission. Scope 2, purchase of energy by hospitals and healthcare sectors, about 11%. Scope 3 are all the other supply chain that includes pharmaceuticals, chemicals, and others, 82%. Well, as the health sector, we need to work in all these areas. Next slide. So for that reason, our Action Collaborative on Decarbonizing the health sector brings together people from all parts of the health sector, a true public-private partnership. This is co-chaired by Admiral Rachel Levine, the Assistant Secretary of Health at HHS, responsible for climate and equity, by myself, by Andrew Whitty, the CEO of United Health, and by George Barrett, the former CEO of Cardinal, the supply chain. True public-private partnership. And the membership includes not only from government, hospital and health system, but also private payers, financing organizations, industry, accrediting bodies, professional education, academia, nonprofits, and others. We have 4 work streams to work on decarbonizing the healthcare infrastructure and supply chain, to look at how to reduce carbon footprint on healthcare delivery, to improve education and communication, and importantly, to create the environment of policy, finance, and metrics that can incentivize decarbonization. Next slide. So the goals and priorities are summarized in this slide. I'll go through them very quickly. Make a business case and health case for health systems, hospitals to minimize their carbon footprint. To create metrics and goals for hospitals and the entire health sectors to measure and to act according to those goals. To develop playbooks and best practices for hospitals and healthcare delivery institutions. To really identify opportunities to reduce complexity and waste in the supply chain. And importantly, to empower our healthcare workers and learners to advocate for decarbonization of healthcare. And importantly, to identify policy and regulatory barriers to decarbonization and to find solutions. And finally, to enhance alignment and coordination of the entire sector, industry, policymaking, regulatory bodies, so we can incentivize low carbon emission innovations and modernize the supply chain process. Next slide. So what can we do by healthcare organization? What can you do? Number 1, to reduce healthcare waste by implementing circular healthcare and sustainable healthcare waste management. To redesign healthcare delivery. For example, when we watch what happened during COVID, the use of virtual care, telehealth, substantially reduced the emission of carbon due to reduction in transportation. So certainly we can think about doing more of this, but also change the healthcare delivery practices by installing more on-site renewable energy and reduce the use of high energy consuming instruments, MRI, CT scan, surgery, you name it, to emphasize prevention over disease and leverage our purchasing power to shift to low carbon substitutions and to ensure our suppliers are decarbonizing their own processes. And finally, to promote research and innovation. Next slide. So in summary, I think the entire healthcare sector needs to work together, to commit together to sustainable transformation and participate in collective efforts. This is what the NAM Action Collaborative is doing, bringing people together to achieve this. Certainly, we want to achieve the goal of a 50% reduction in greenhouse gas pollution by 2030, as set by the Biden administration. By doing what we do in our own sector, we can galvanize other sectors and the public to take actions. And finally, the most important issue, of course, is to improve and protect human health, well-being, and equity. So thank you very much to listening to me to open this session, to set the stage. And I wish you a very excellent meeting. Thank you very much.
Well, thanks to
Hello.
Dr. Dzau for those pre-recorded remarks and for his leadership. The National Academy of Medicine has incredible convening power, and we're really hoping this helps scale the work throughout the sector. The next speaker is Beth Schenk, who's the Executive Director of Environmental Stewardship at Providence. And Beth is also sitting on the Healthcare Delivery Working Group of the National Academy of Medicine Action Collaborative. Providence is also a member of the U.S. Healthcare Climate Council. So Beth, I'll hand it to you.
Thank you so much, Jessica, and thank you all for inviting me to speak today. I'm thrilled to be able to share a bit about how one health system is doing this. And as we all get more engaged, health systems, hospitals, clinics, public health departments, it will be really great to learn from each other on the best strategies for decarbonizing. Next slide, please. So Providence, as mentioned, is a large Catholic health system with over 50 hospitals, 1,000 clinics, 120,000 caregivers, which is what we call employees, offering all sorts of services in a wide range of settings. Next slide. In fact, those settings are in 7 Western states, and there's quite a lot of variety and diversity. Next slide, please. From Alaska to Texas, with large urban medical centers as well as small critical access hospitals across our range. Next slide. In 2020, on Earth Day, in fact, our president, Dr. Rod Hochman, who some of you know is recent past president of the American Hospital Association, announced our goal to become carbon negative by 2030. His quote here echoes our deep commitment and alignment, I would say, with our mission, and also in our vision, which is health for a better world, and in service particularly to those in need. Next slide. I'm going to talk a bit about how we plan to get there, because this is an enormous goal and where we are so far. So we have developed our climate action plan. You can link to our externally facing website using this QR code or that link. And I think these slides will be shared. And I'll walk us through the high points. Next slide. First of all is really goal setting. And we've been asked how we came to this goal, which is incredibly ambitious. And we know that. It wasn't easy because the solutions to our climate crisis are so complex and healthcare has many competing priorities all the time. So in 2019, even though we'd been working on environmental stewardship for decades, in fact, our earliest record is back to 1993. But in 2019, a small group of technical experts in Providence took on this challenge. What should our goal be? And after much discussion with leaders, came to the decision to aim to be carbon negative. And you can see in the left box, first we had to consider how much of our emissions do we intend to address? And we looked at what some other health systems were doing and other industries. And as you've heard both Jessica and Dr. Dzau say, there's a lot of opportunity for discernment here. Electricity only, energy only, all of scopes 1 and 2, or a few elements from scope 3. And we ended up, because our mission is rooted in justice, our core value of justice, we felt like, well, how can we just take on part of this and not all of it if we are causing harm with our emissions and our pollution? So that led us to take on all of scopes 1, 2, and 3, and then some. That's what the carbon negative means. So essentially, we have a net zero goal here, and we've committed to going a bit further, not to take on all of our historical emissions. That would be amazing, but also really, really daunting. All right, so then we thought of our span. You saw the size of Providence. We also have a university, high school, multiple long-term care facilities, many ambulatory surgical centers, and other outpatient facilities. We have a number of spin-off companies. We even have a technology center in India. So we asked ourselves if we should include all, and we ended up coming to a similar conclusion. If we're committed to reducing and eliminating our emissions, how could we choose just some sites? So we chose everything. And then the timeline, and you can see that ours is quite aggressive. But we listened to the scientists who said this decade, the 20s, is really a make or break period. We are living today in our sites along the West Coast with wildfires, poor air quality, heat waves, and we really feel the urgency to act now. Thus, we landed on 2030, which we know and feel every day is fast approaching. Next slide, please. So you may wonder, how on earth are we going to do this? And I'm going to walk you through a few key pieces of our strategy. So first, we developed the We Act framework to both organize and communicate our efforts. We believe that at least 90% of our mitigation efforts are addressed in these 5 buckets if we think broadly. And so we are working on numerous projects and programs in each, and we are measuring each category. For instance, we're working on waste optimization across all sites. We're working on numerous energy efficiency projects and purchasing more renewable electricity. We are reducing the carbon intensity of foods. We are working with our medical director in our region of Oregon, Dr. Brian Cheeseborough, who's been really working on driving down emissions in our inhaled anesthetics and nitrous oxide. For transportation, we have benefited from the pandemic in this regard, but now we're working to keep those business travel miles low and keep our employee commuting down through hybrid workspaces and other metrics. Next slide, please. There's another piece of this framework, which is represented by the word please. And let me say that the phrase "we act" is very important for obvious reasons. It gives people a quick guide to, hey, what should we focus on? And those 5 buckets will get us a long way down the road. But it reminds us that it depends on our action and it depends on we. This is not for one discipline or one department or one person. This is a global effort. And so I'm thrilled that all of us, even today, are talking about this today. So if we think about please, just briefly, I'm going to race through these because these are what I would say are strategic and organizational elements that are key to success. They're probably key to any initiative, but they were designed really for this environmental stewardship initiative. Professional obligation is important to this group because as a group of clinicians, we know that we're called by our professional commitments to do no harm, to help ease suffering, to not be part of the problem. In nursing, we have a standard of practice that says the registered nurse practices in an environmentally safe and healthy manner. That is pretty clear, but what does that mean? It's more cloudy then. So we can rely on our professional obligation. And I would say this at an organizational level too, relying on our obligations from our mission and from the commitments we've made to our communities. Leadership, both formal and informal, is crucial. We benefit greatly in Providence right now from strong leadership from the president through the executive council, regional leaders, et cetera. And it's so helpful when they speak out and they write about it and they include it in our strategic planning and in the expectations that they lay out. Very important. It's also important to have grassroots leaders who help with the operational level changes that are needed. Education is necessary, and you all are getting education here. More and more schools from pre-practice are getting education, but really not enough yet, I wouldn't say. And we know something about that from measurement. But it also takes ongoing education because this crisis changes. We learn every time there's a new IPCC report. We learn with all of the thousands of studies that come out every month. So it's important to continue to rely on education. Accountability is huge and kind of hard to achieve. We have benefited from weaving our carbon negative goals into our standing annual metrics that all leaders are accountable to. This has been really important for elevating visibility, for communicating to leaders throughout the organization. And we spend a lot of time on identifying and sharing accurate, transparent data. That's a piece of accountability, and I'll come back to that. Science. You know, you would have thought we did not need to call out science as being an important element to lean on. But we are living in a time when science has been questioned, when we are up against a lot of misinformation, and that's not easily solved and is probably not going away. So we need to then plan for that. We need to keep in mind, how do we educate and rely on evidence when there's so much noise around it? So it is perfectly legitimate for us to use high quality evidence and communicate it clearly so that we can be true both to the demands of the crisis and also have justification for our decisions and policies. The last E is for engagement. I call it the secret sauce. And this is how we invite and include others, how we communicate, inspire, share successes, help people find ways to engage that are meaningful to them personally. This comes back to the we, as this is not something that that can be accomplished by a small team. So we need to invite, and we need many, many hands. I would also say here that it has been immensely helpful to have a simple but powerful goal. I did not appreciate that before. When we started planning the goals, I thought, well, we're going to need a goal for waste and a goal for water and a goal for energy. But really to have one goal that you can say in 4 words, is it? Yep, 4 words. It's easy to remember. It's easy to rally around. And it seems like it's manageable to people when they say it. Now, I hadn't appreciated the power of that simplicity before, but I think it has helped us advance. Okay, next slide, please. And I'm going to go fast. I don't expect you to read this, but I want to show you the span of our approach. So this is like a visual strategic plan. And this has been helpful to show caregivers in Providence because they see kind of where they fit in and how all these pieces are moving together. And they are all moving together. That top right quadrant is what I just told you about. We act. But there's a whole lot more on this page, obviously. On the left is kind of what's incorporated in the please documents, please ideas. So I'm not going to go through this right now because I'm running short on time. But let's go on to the next slide because I want to show you a little bit about our structures. So we have a system-wide leadership team. Next slide, please. Representing many divisions. This is the group that's really responsible for meeting our goal. All of those blue circles are different divisions in our organization at a system level. So we have people that have been named by the vice presidents or the highest officer in those divisions to sit on this council. And they actually, report back to their teams. They bring information from their teams. And then the regions, we have 7 regions that are mostly geographic. And this is our connection to the regions from this group. The work is housed in the Advocacy and Social Responsibility Division. This is important because our Vice President, Ali Centauri, reports to the Executive Council and has broad reach across the organization. So we have breadth. And then we work very closely with our real estate division, which is our buildings. And that gives us a lot of penetration into the depth. It's hard with 52 hospitals in 7 states. So we feel like this structure is important and it's working for us. Next slide. Our initiative, as I've mentioned, is anchored in our core value of justice. You've heard already from Jessica and Dr. Dzau about the importance of EJ work. So we've taken this on and we've been meeting for about a year and a half now to scan what are the issues in the communities we serve, what are the divisions in our health system that are working on this, and how do we make sure that we build in keep our eyes on environmental justice issues so they're not forgotten, because they are easily forgotten. It's kind of troubling. So we're proud of this work and we'll be rolling out some findings, probably I hope by Q3. Next slide, please. Regarding the delivery of care, so a lot of what folks here at this call are interested in, this image captures the problem. And this is what Jessica was saying earlier. People come to us in need of healthcare services. We inadvertently create pollution, and this contributes to disease and illness, and people come back to us for more care. So if you just push the advance button once, you'll see a lightning bolt that indicates disruption of that harm. One more slide, please. And this is the point that catches clinicians, especially when they start to realize that care they deliver is harming the planet and therefore health. So this is where decarbonization sits. This is where mitigation sits. We also work on adaptation and advocacy and leadership, but this is what we're kind of talking about with decarbonization. Okay, so next slide, please. We are in the early phases of transforming clinical practice to ensure that it's in alignment with our environmental goals. This is enormous and really exciting. You can see the numbers here of clinicians in our health system, and this I think would be typical of other health systems. Dr. Cheesebro, who I'd mentioned, is a fabulous example of a clinician, an anesthesiologist who's digging into the details of practice and finds feasible solutions supported by smart analysis. That's essentially our model. We need to dig in to the specifics, use what we all are good at, using evidence, using process change, and make decisions that will have better outcomes. His perspective is enormously valuable. I bring a nursing perspective to help the largest single clinical group, nursing, to transform our practice. There's both a lot of energy among clinicians and a lot of need to address pollution, assess and address pollution arising from these practice decisions. As Dr. Dzau hinted, there's a lot of research to be done. This is an area of practice that we don't fully understand. And so I am excited that in the next decade, much more will come in that regard. So we are strategizing now how to engage, communicate, and measure this transformation on a broad scale. Next slide, please. All of this work is data-driven. And if you have been in this field for long, you know how complex it is. We have been working for years to wrestle down our stewardship data. And for the past 18 months or so, we've been building our own database, the WEAC scorecard. Our leadership, I mentioned this before, had the impressions to develop a technology center for Providence because we're so technology driven, so dependent, and using lots of apps, and just managing our EHR is enormous. And so this is the Providence Global Center in Hyderabad, India. So our team, our environmental stewardship team, works closely with caregivers in Hyderabad several times a week as we develop this incredible tool. In it, we're tracking usage of any commodity, electricity, waste, anesthetic agents, cost of that particular element, and carbon footprint, carbon emissions, using the greenhouse gas protocol that Jessica talked about for all these categories across all 52 acute sites. We'll be adding the non-acute sites later this year, except it'll take a while. So we can compare change over time, change across locations. We can compare hospitals to all other hospitals or to a region or to themselves at another time frame. And we just know that this work is so complex. And even though this is an enormous effort to get this scorecard lifted off, we just didn't see a way around the necessity of transparent, accurate data to drive it, capture savings, very important part of the story, and to tell our whole story. Next slide, please. So how are we doing? Well, we are wrapping up our 2021 data right now. And here are a few results with more coming later. We'll have our first annual report for environmental stewardship coming out in Earth Day or in that week. So you can see that we have reduced carbon emissions in the hospitals in the 7 categories that we're measuring currently by 11.7%. 26 healthcare facilities in Washington and Oregon particularly are operating on 100% renewable electricity. We've reduced emissions from anesthetic agents by 70%. This is just since 2019. If you go back further, it's more like 85%, saving $3.5 million annually. Reduced business travel, and I acknowledge that this is largely part of the pandemic results, but as mentioned, we hope to keep them at 25% of 2019 travel rates, and that saves over $5 million a year. We've had national leadership opportunities. As you can see, we've really involved with advocacy from a lot of fronts that I won't have time to talk about today, and we really enjoy our collaborations. Certainly with Healthcare Without Harm, we have a very close working relationship and rely on their expertise. The AHA, I mentioned, the Catholic Healthcare Association, because we're Catholic, and National Academy of Medicine now, and many others. So that's an important piece of doing this work together because I said it's we. And I think I have just one closing slide. Next slide, please. This statement, I mentioned that our vision statement is health for a better world. So this statement came out of our strategic planning process, just that we act together on health for a better world, but it's really through anchoring our work of environmental justice here and environmental stewardship and in our core value of justice. So thank you very much.
Beth, thank you so much. How lucky Providence is to have you. And I always appreciate the leadership role Providence is taking really across the board, acknowledging this tremendous undertaking, whether it's, from meeting with policymakers and administration officials, to working on the reporting and data, to engaging your whole health system, every caregiver. Since our audience today is primarily health professionals and we have very little time, I want to kind of dig into that a little bit more. You talked about Dr. Brian Cheesebrough. He's one of probably 8 in the country medical directors of sustainability. He has really led so many efforts, and he really became, he had some national prominence because he compared the way he engaged the other anesthesiologists in this work. So maybe you can talk about that for a moment, just tell that story quickly. And then also talking about how do you engage clinicians? We know how busy they are and how that fits into your framework.
Well, yeah, especially busy during a pandemic, let me tell you. And you all know that. We kind of had communication shut down from time to time, as I'm sure happened across the nation. But let me talk about Brian's work. He's an anesthesiologist in Portland, Oregon, and some of you I'm sure know him. And he is the medical director of environmental stewardship for Oregon. But of course, we pull him into system work whenever possible. And he's helped lead the change across the whole health system for volatile anesthetic agents. So those inhaled agents, desflurane, sevoflurane, isoflurane, which hopefully are familiar to many of you. If we shift away from desflurane, we can drop our greenhouse gas emissions substantially without any loss to the quality of care delivered, and we save millions of dollars. So it's kind of an easy sell, but change is never easy. So he was able to pull out specific use data from the EHR so he could tell each provider what their footprint was and compare that. Oftentimes they were providers who were really concerned about their emissions, and they had no idea that their choice of this drug was sometimes 10 times what their emissions were for the rest of their life. So that was an effective way to do it. Really peer-to-peer communication with solid data, I think, has been part of his success. And also it makes so much sense, that particular issue. He's now really working on nitrous oxide. Nitrous oxide, if you haven't paid attention, is a little bit of a sleeper issue in healthcare. It's very inexpensive. It's hidden, it's behind the walls, in pipes that run behind the walls. But what we've found is that 80 to 90% of our purchased nitrous is wasted. It leaks. And so this is even in new buildings. So this is something across the nation, I suspect we could reduce many thousands, if not millions of tons of CO2 equivalent. So he's developed some really great techniques for weighing tanks, doing an assessment at a very specific hospital level, and also comparing it to clinical use from the EHR. This is a really important piece, is what we're sitting on in terms of the EHR is just fabulous data. It reminds me of, just a quick diversion, Jessica, but it's clinical. Dr. Karen Boudreau is one of our physician leaders in population health. So when we had these ridiculous temperatures in Oregon and Washington this summer, 116 degrees in Portland, Oregon, it was pretty scary. And so she had been already paying attention to public health data and our population, you know, the folks we insure, their data, and then started to apply that to specific EHR diagnosis related data. And they could then send community health workers to the homes of people that they knew were at particular risk from heat. So this is a really, I'm assuming that this is the way that we go in healthcare more, for personalized care, with these changes that sometimes come up before you know it in terms of exposures to smoke, wildfire, and heat. That's kind of what we're dealing with in the West. So that's an example. Did you have a second question there, Jessica?
Well, since you mentioned EHR, there was a question actually in the chat about how you're using, or if you're using EHR as a way to educate your caregivers and patients.
So if like for discharge instructions, perhaps for patients?
Yeah, it was a general question, but I
Okay.
think we know this is nascent. We know that there's certainly interest from Epic in thinking about this. We've met with them several times. But are you able to use anything in EHR now? I mean, your example is beautiful about using it to really identify disproportionately impacted patients or vulnerable patients.
Right. I would say, to my knowledge, and I would need to clarify this for sure, we're using data from the EHR rather than pushing out data through the EHR. And partly that's because it's difficult. We're going live right now with Epic in our last region, and that's Texas. So they are going live right now. And then we will all be on the same Epic platform. I'm hoping that it will be easier then to influence Epic. And I know not everyone uses Epic, but otherwise it's challenging when we have multiple versions. So I know that a number of people have been meeting with Epic, go regularly to Madison to talk about what our next iteration would include, and working always on patient education. So I expect this will be one of the things that we want to pull out in our clinical collaborative work.
Great, thank you. And I know, Mona, we are at time. Just want to address one last question, which was about Laudato Si, and if that's part of the inspiration for Providence. I do want to add that our faith-based systems are leading in this space. This past year, both Ascension and Common Spirit Health, our largest nonprofit health systems in the country, but both with over 140 hospitals, set net zero goals by 2040. So as Reb said, that the mission and the spiritual path are, I think, very critical in pushing health systems. And Beth, maybe you have the last word there, and we'll turn it back over to Mona.
I would say, you know, probably for all health systems, but certainly in Providence, if there is no significant initiative that is not in alignment with the mission. It has to be. It's really crucial. We'd spend a lot of time with mission integration, mission formation. We're very committed to our mission. That doesn't mean we're perfect all the time, but we would not invest the time, resources, and effort into this if it did not align. And it aligns for all sorts of reasons. Our commitment to justice, our mission is in service of the poor and vulnerable. So that is climate change right there. I do think that Pope Francis's messages through his leadership period, papacy, have been very important and very helpful. I remember waiting with bated breath for Laudato Si to come out in 2015, and we use it a lot in quotations. We're now one of the early signers of the Laudato Si Action Platform, and that's reporting changes and movement toward decreasing greenhouse gases, as well as environmental justice, education, purchasing, waste, a lot of different elements. So I do think it's important for us because it makes sense to people. It makes sense to people internally and externally. And we wouldn't do this if we didn't have the approval of our board and sponsors, our Catholic sponsors, who are really one of the backbones of leadership outside of the health system, but really in terms of advocating for us and leading us. Thank you.
Thanks for
All
having
right.
us, Mona. And I'll turn it to you, or Lisa, it looks like.